Hello and welcome to an online version of Acute Medicine Quiz 1. This is an accessible version. There is already a PDF version with the answers on Moodle already, but this is the video version. My name is James Parapon, Senior Clinical Teaching Fellow in Acute Medicine at the Royal Free. So far I've put 3 quizzes online. They cover broad areas of acute medicine. Some will have images and ECG strips. This of course is a single best answer quiz in keeping with the others and your exam format. If you have any questions you can email me directly or you can put them on the Q&A section on Moodle. So let's begin. Question 1. A nurse shouts for help. You find a patient with agonal breathing. What is the most appropriate next steps? Is it A, call for help, apply a non-rebreathe mask at 15 litres of oxygen, B, call for help, perform a head tilt chin lift and apply a non-rebreathe mask at 15 litres, C, apply a non-rebreathe mask at 15 litres of oxygen, D, call for help, open the airway, apply a Venturi type oxygen mask, E, call for help, open the airway and commence CPR. Question 2. An ECG rhythm strip is shown. What is the single most appropriate next step? Is it A, commence CPR for 2 minutes or cardiopulmonary resuscitation, B, immediately defibrillate at 200 joules and then begin CPR for 2 minutes, C, administer 1 milligram of 1 in 10,000 IV adrenaline, D, immediately insert an endotracheal tube and then begin chest compressions, or E, commence chest compressions in a ratio of 30 compressions to 2 ventilations. Question 3. A 28-year-old female presents with acute confusion. She has taken an aspirin overdose. She is vomiting. Her blood pressure is 90/50. What is the single best next step? Is it A, arrange urgent hemodialysis, B, administer activated charcoal, C, administer intravenous sodium bicarbonate, D, perform gastric lavage, E, infuse IV Hartmann solution? Question 4. A 42-year-old woman presents with diarrhea and vomiting. These symptoms began after a road traffic accident. She has been confused and slurred her words. Her heart rate is 115 beats per minute and her blood pressure is 85/50. Her bloods show an HB of 116 grams per litre, platelets 364, sodium 125 millimoles per litre, potassium 6.4 millimoles per litre, creatinine 150 millimoles per litre, and random glucose 2.8. What is the most likely diagnosis? Is it A, autoimmune adrenal failure, B, gastroenteritis, C, hypothyroidism, D, insulinoma, or E, syndrome of inappropriate antidiuretic hormone, or SIADH? Question 5. A patient presents to the acute medicine unit with palpitations. She then develops central crushing chest pain radiating down her left arm. Her blood pressure is 88/55, respiratory rate 20, and oxygen saturations of 98% on room air. A cardiac monitor was attached and shows an irregular, narrow complex tachycardia with a ventricular rate between 150 and 160 beats per minute. What is the single most appropriate next step? Is it A, intravenous adenosine, B, intravenous amiodarone, C, intravenous digoxin, D, intravenous flecainide, or E, synchronized cardioversion? Question 6. A 23-year-old female collapses after eating a Chinese meal. You suspect anaphylaxis. In what dose and route should adrenaline be given? Is it A, 500 micrograms of 1 in 1,000 intramuscular, B. 500 micrograms of 1 in 1,000 intravenously, 1 milligram of 1 in 10,000 intramuscularly, 1 milligram of 1 in 10,000 intravenously, or 10 milligrams of 1 in 1,000 intramuscularly. Question 7. Which clinical condition does the CURB-65 score apply to? Is it A. Acute GI bleeding, B. Community-acquired pneumonia, C. Atrial fibrillation, D. Asthma, E. Hospital-acquired pneumonia? Question 8. Examine the chest X-ray on the next slide. What is the most likely diagnosis? Pause here until you have the answer. Is it A. Acute respiratory distress syndrome or ARDS, B. Right upper lobe pneumonia, C. Right middle lobe pneumonia, D. Lung malignancy, or E. Wedge pulmonary infarction? Question 9. A 72-year-old woman presents with palpitations. She has type 2 diabetes and hypertension. She takes irbesartan, gliclazide, amlodipine and simvastatin. Her blood pressure was 132/82, heart rate 130 beats per minute, and her saturations were normal. On auscultation, her chest was clear and her heart sounds normal. Blood tests showed a normal UNEs and a TSH or thyroid stimulating hormone of 3.2 megaunits per litre. The ECG shows atrial fibrillation. What is the most appropriate next step? A. DC cardioversion, B. Intravenous digoxin, C. Intravenous flecainide, D. Oral digoxin, E. Oral bisoprolol. Question 10. A patient with liver cirrhosis has a variceal bleed and is vomiting. He has a history of alcohol abuse. His HB is 9 grams per litre and blood pressure 140/70 millimeters of mercury. What is the single next most important intervention? Is it A. Intravenous omeprazole, B. Intravenous fresh frozen plasma or FFP, C. Arrange immediate intubation and ventilation, D. Blood transfusion, or E. Non-invasive ventilation? Question 11. Jack has ingested heroin. He has a respiratory rate of 4. His BP is 100/70 millimeters of mercury. What is the single best management plan? Is it A. Airway oxygen IV fluids, B. Airway oxygen flumazenil, C. Airway oxygen ventilate, D. Airway oxygen naloxone, E. Airway oxygen ventilate and naloxone? Question 12. Jack then has a cardiac arrest. The FI1 takes an arterial blood gas. What is the most likely finding on the blood gas? Is it A. Metabolic acidosis, B. Metabolic alkalosis, C. Mixed metabolic and respiratory acidosis, D. Mixed metabolic and respiratory alkalosis, and E. Respiratory acidosis? Question 13. Margaret wakes up short of breath. She is hypotensive and has bilateral crackles in her chest. Blood showed a sodium of 128 millimoles per litre, potassium 8.5 millimoles per litre, urea 18 millimoles per litre, and a creatinine of 185 millimoles per litre. Her ECG is on the next slide. What is the most appropriate initial treatment? And here is Margaret's ECG. Pause here until you're happy that you have the answer or the ECG diagnosis. So the possible answers are A. Treat as non-ST elevation myocardial infarction or NSTEMI, B. Thrombolysis, C. IV calcium gluconate, D. IV insulin and dextrose, and E. Nebulized salbutamol. Question 14. Doris is admitted with a dense hemiparesis after an MCA or middle cerebral artery infarct. She had a previous diagnosis of heart failure. Her saturations on room air is 95%. What best describes Doris's oxygen requirement? Is it A, 2 litres of oxygen via nasal cannula, B, 5 litres of oxygen via simple face mask, C, 15 litres of oxygen via a non-rebreathe mask, D, no additional oxygen is required, or E, 24% oxygen via a Venturi face mask? Question 15. Fred presents with increasing shortness of breath. On examination, he has decreased breath sounds on the right. He appears cachectic. A chest X-ray shows massive right-sided pleural effusion. His oxygen saturations on air are 85%. What is the single most appropriate next step? Is it A, arrange urgent pulmonary angiogram, B, perform pleural aspiration, C, perform pleural tap, D, insert intercostal Seldinger chest drain, or E, administer high flow oxygen? Question 16. Which of the following are indications for an HIV test? Is it A, tuberculosis, B, non-Hodgkin's lymphoma, C, pyrexia of unknown origin, D, cervical cancer, or E, all of the above? Question 17. A patient presents with ongoing chest pain. An ECG is performed in rapid assessment triage. The ECG is on the next slide. What is the ECG diagnosis? And here is the ECG. Pause until you think you have the answer. Is it A, anterolateral ST elevation MI, anterolateral non-ST elevation MI, inferior ST elevation MI, anterior ST elevation MI, or posterior ST elevation MI? Question 18. A 26-year-old female is admitted with hemoptysis, shortness of breath and pleuritic chest pain. She takes the oral contraceptive pill and smokes 20 cigarettes per day. Her blood pressure is 120/80, heart rate 120, and saturations of 92% on room air. Her ECG shows sinus tachycardia. Her chest X-ray is reported as normal. Her D-dimer is 766 and her troponin is 75. Her CRP is 110. What is the single most appropriate next step? Is it A, broad spectrum antibiotics, B, low molecular weight heparin, C, nitrate infusion and treatment for acute coronary syndrome, D, reassure and discharge to GP, or E, thrombolysis? Question 19. A 45-year-old man presents with bright red rectal bleeding. His heart rate is 125 and blood pressure is 90/50. His urea is 17 millimoles per litre and creatinine is 100 millimoles per litre. Where is the most likely bleeding source? Is it A, diverticular disease, B, duodenal ulcer, C, hemorrhoids, D, esophageal varices, or E, rectal polyp? And that was the final question, so the quiz is now complete. There will be a separate document on Moodle and video with the answers. Good luck and thank you for listening.